The HSE is the government agency that provides all public health and social care services in Ireland. There's over 100,000 people involved in the provision of health and social care services in Ireland. So we are the largest single organisation in the state. We have around about 30 very large programmes within the overall programme for health service improvement. I suppose when you're looking at a large programme such as this, having access to the information that's relevant around those programmes is important. You know, being able to manage interdependencies between programmes. Too often in the past we've relied on desktop type project management tools which are very standalone. There's no kind of interoperability there from program to program. A lot of it's just done through verbal communication or emails, and it's slow and it's unreliable. We are a system of organisations. Not all of the organisations are HSE, and therefore they don't have access to the same networks. By going to a web-based solution that the Cora system has allowed us to bring all of the different stakeholders throughout the health family together, working on the programs as they need to do, and they have access to the same tools and the same information at the same time. And that's extremely powerful when you come to managing things like risks, when you come to managing things like project issues. The escalation of that is a much more straightforward thing. If I was to describe to you that in order to implement a hospital group, you have 114 projects that you have to implement fully. That's how complex these things are. We're doing 7 of those, and that's just the hospital group side. What you don't want as the head of acute hospitals is to have to go through 7 programs and then dig into the 114 different work streams and projects in there to try and find the information you're looking for. What we're able to do within the system is flag the information they need and layer the reporting that brings the right decisions to the right people, so they're not having to trawl through all of this detail. It's a much more efficient use of management time. And there's a multitude of tasks involved in delivering these complex programs. What we're saying is write those down in the Cora system. And what that does is it gives not only you, but it gives your colleagues a view of the work and lets them see what their tasks are, and it brings it all together, and it does a lot of the reporting for you. And that's where they're saying it's making their life easier, and it's giving the stakeholders, the sponsors of these projects, a confidence that previously wouldn't have had, because they've got visibility of progress, they've got visibility of the risks, and they can assess themselves then as to whether things are going to plan or not. It's a single version of the truth for all of our programs. That's something that we never had before. We get really good management information that's configurable to our needs. Again, you don't get that from having all of those many hundreds of projects and tens of programs distributed over perhaps 150 laptops around the country. Where's the single version of truth in that? We would recommend Cora when you're trying to manage a complex set of projects and programs. It is the ideal tool. It's also the ideal tool, by the way, if you've got a small single project that someone wants to do themselves. We advocate within the system that they use the Cora system to actually do that too, because it's simple.